Hi, my name is Lonnie. I'm here today interviewing Anjana on a public health topic that means a lot to her. I'm going to let her introduce herself. Hi, Anjana, how are you?
Hey Lonnie, thanks for having me. Yeah, just a bit about myself. I'm a third year undergraduate at UCLA. I'm majoring in neuroscience. And the issue I talked about, or the issue that I'm passionate about in public health is isolation, especially in older or geriatric communities.
Very cool. Just kind of to start this interview, where did you first learn about this public health issue and why did it pique your interest?
Yeah, so I think my interest started as a personal one, mostly just seeing my grandparents. So my grandparents, they live in India, and my parents and I obviously live in the United States, and so there's huge geographic barrier between us, and it also meant that we couldn't be as close, or we couldn't visit them as often as people who were just, geographically closer. And I think as my grandparents got older and I also got older, I became a lot more aware of how that separation was, taking a toll on their physical health, but also maybe even to a greater extent their mental and emotional health. So that was what piqued my interest. And then when I got to college, I also volunteered for a bit in the geriatric unit of the UCLA hospital. And as a volunteer, I was there to, provide company to senior patients who were there and who didn't have family visiting them. And it was honestly the same issue, but on a much bigger scale. People, and also more severe, people in the hospital without company, and again, seeing how that was kind of bleeding into their physical and emotional health.
Very cool. It's very interesting how these broader issues can kind of hold very close to our hearts at times. What would you say, what do you think is a good strategy for us to kind of combat this broader public health issue?
Yeah, I think it's challenging because it's interconnected with so many other things that are also, oh my God, that are also very difficult to address. I think especially in the senior population, mobility is a huge issue. Just moving around is a lot harder as people get older, and so it's not as simple as just joining a club or going to a community center. So there's kind of there's often geographic barriers, and there are also physical barriers to connecting with other people. So I guess the best approach is one that kind of attacks it from all angles. So geographically, maybe finding ways to physically move older communities together, whether that's through more centralized, urban planning, maybe things like that. And then also mobility issues. So how can we develop infrastructure to take people to places, people who are older? How can we provide senior friendly transportation that's affordable, accessible, reliable? I guess those are the two main angles from which I think we can start approaching this issue.
Awesome. What would you say is maybe a core memory that you've had, perhaps working with this population, and kind of, this is, I guess, two questions in one, and also what steps do you plan on personally taking, if any, to address the issue?
Yeah, as far as personal memory, I think I remember a lot of the encounters I had as a volunteer very fondly. I guess fortunately, these patients weren't in the hospital for very long. So the I guess downside of that meant that I wasn't able to build lasting connections with these people. But even just spending an hour or two with them on shift, I think maybe one of my favorite things that I learned, a lot of times we're told that it's so hard for people from different generations to connect, and there's no way that people who are 4 or 5 decades older than you could find common ground. But I think just talking to them, you realize it's really not true. A lot of patients I talk to, their favorite shows were Shark Tank. I remember I watched that for a few hours on shift. So, and even just things that seem trivial can really be a great launching point for connecting with people who we thought we didn't have much in common with. So just finding that common ground was always a really nice experience. As for personal action, I recently joined this amazing organization called Scope, which is working to address a lot of these public health issues that are, also connected to broader social determinants of health. And so I think as a member of the lovely outreach team, I'm hoping to, first create media. I think loneliness is one of those things that actually is not talked about enough. Things like smoking or, exercise, those are all they immediately come to mind when you think of public health, but loneliness is not one of them. So I think first, just getting people's stories out there would be a good first step.
Awesome. Thank you so much for sharing, Anjana. These were very insightful, and I know I learned a lot, and hopefully we can address this issue head on in scope. Thank you.